My name is Eric Walker. I'm a cardiovascular sonographer. I serve as the program director for the Clemson Cardiovascular Imaging Leadership Concentration, and I've been with GHS and Clemson for about 10 years. Cardiovascular sonography is a non-invasive testing technique that looks at the cardiovascular system, so specifically the heart, the arteries, and the veins. And so we look at circulation issues that include not enough blood flow getting to the limb or blood flow not being able to get out of the limb, heart failure, heart attacks, strokes, things of that nature. This program began back in 2011 out of a workforce development need. So there was a shortage of sonographers, and most of what the Greenville Health System was hiring, we had to either pay a sign-on bonus and or fly people in from out of state to come in and interview, which can become a very expensive process when you're trying to interview 5 or 6 candidates for an open position. The cost of training someone to enter a healthcare system is about 6 months of time and several thousands of dollars. So what we didn't want to do is bring somebody in from the outside who decided they didn't like the area, they didn't like the healthcare system, they didn't stick around long term. And so we wanted to develop our own pool of talent. And so what we did is the Greenville Health System and Clemson University partnered together, Clemson to provide the degree and the academic pathway, and Greenville Health System to provide the clinical opportunity. And so what we have is a very robust program that trains undergraduate students to perform cardiovascular ultrasound. We're one of only 6 accredited CVT programs in the nation, and we're the only one that does both adult echocardiography and vascular sonography in conjunction with a public health science degree. The Clemson Cardiovascular Imaging program is 5 years old. We have graduated a total of 23 students, so we're a very small concentration. Part of that is by design because this is not a spectator sport, is what I like to call it. You can't learn how to do this by sitting on the sidelines. You have to actually have the probe in your hand on the patient practicing your skill. So for us, it's less about quantity of students coming through and it's about the quality of the students and the grads we're producing. So for us, with outreach, we're looking for students who are connected to the healthcare career fields. So a lot of times I'll go out and talk to high school and middle school students and they want to be a doctor or a nurse and they don't even know that sonography even exists, or if they do, they think radiology is all lumped together. So for us to go out into the outreach program, it's as much about talking about the field of sonography and how we contribute to the healthcare team, as much as it is looking for bright students to come in and make a difference in the profession moving forward. I want my students to think about the patient that's below the transducer when they're scanning. We have an adage here, and this is true in all of healthcare: if you treat the patients as if they're your grandmother or your grandfather, you'll never go wrong. As soon as you start trying to assembly line people or refer to someone as an add-on or the 10 o'clock appointment, the empathy and the ability to focus on that one individual at that time is lost. And so what I want my students to understand is that every patient is an individual person and they need to do their utmost to help diagnose and discover what it is that's going on with that patient. And so my students need to understand the difference that they can make. This is not a picture-taking job. It's not an assembly line. This is a situation where they have to pay attention to the finer details. They have to talk to their patients. They have to touch their patients. They have to understand that the images that we take reflect the story that the patient has. So we need to be sure that as we're going through our job, that we're paying attention to detail, we're getting the right information at the right time so the patient gets the right care. We want to make sure they get better, not worse. And so the motivation for me is creating people who have high integrity, who have great time management skills and use their critical thinking ability to make a difference in each and every patient that they touch.